Prices for health insurance plans through the Affordable Care Act marketplace are dramatically increasing because Congress hasn't taken action. Felicia Burnett from Moms Rising explains what's happening and how you can take action to stop the healthcare price hikes. Welcome to Care Talk Live, where we talk about how healthcare works or doesn't work in America and get you answers. I'm Laura Packard, cancer survivor and healthcare advocate, here to help you. Please text or call in your health insurance and healthcare questions at 202 838 6837, and our experts will answer them in future episodes. Be sure to subscribe to my channel or podcast wherever you get your podcasts to get next week's Care Talk show. In today's episode, we're talking about why health insurance prices are going up next year, what Congress has failed to do about it, and what you can do about it. So welcome Felicia Burnett, the National Director of Storytelling Innovations and Healthcare for Moms Rising.
Hey, Laura. Thanks for having me. I'm excited to talk with you today.
So let's start with what's going on. Why is our health insurance costs going up next year?
Well, we are less than 30 days away from the ACA premium tax credits expiring at the end of this year. So if Congress, specifically Republican leaders in Congress, fail to act, then healthcare costs for more than 20 million people, 20 million Americans, are going to double, so in some cases triple, and then nearly 5 million people could lose their coverage entirely. It's really one of the biggest attacks on affordable healthcare that we've ever seen in this country, and especially right now, where nearly half of Americans are already saying that healthcare is hard to afford. And with 2025 kind of being the year of sticker shock, we at Moms Rising are calling it Trumpflation. From groceries to prescription drugs and the healthcare cuts that Republicans made in their big ugly bill last summer. It's only made things worse, and families just simply cannot take another blow at this point. So what's happening is that we know last summer, Republican leaders gave corporations and billionaires huge tax breaks, and then they cut $1 trillion from healthcare programs for America's families. Now, in Congress right now, Democrats say that they're ready to vote to extend the ACA premium tax credits that are expiring. This will lower costs, and they really only need a few Republicans in the House to join them to force a vote. It looks like the Senate's going to vote later this week. But what it's important for folks to know is that this is a crisis that affects everyone, whether or not you have an ACA marketplace plan. Because when millions of people lose their insurance, on top of the millions of people who are going to lose insurance from Medicaid cuts, when ACA folks also lose their insurance, the entire health system becomes strained, and costs are going to rise for everyone. Hospitals will close, and that includes maternity wards and nursing homes. And right now we're hearing from families all across the country that they're facing impossible choices between receiving treatment and buying prescriptions or affording their basic needs like food and housing.
So can you share some of, well, first, let's start with what is Moms Rising?
Yeah, absolutely. So Moms Rising is a national organization. We have over 1.2 million members. And currently right now, 1 out of every 300 people in the US are active Moms Rising members. So we have a broad reach in all 50 states and Washington, D.C. We're an advocacy group that works on issues that impact women's and children's health and economic security. I'm the storytelling and healthcare director. So I have the awesome job of talking with families all across the country about how policies are impacting them, and then helping those folks get those messages to Congress. Just last week, we had 2 of our Moms Rising storytellers on Capitol Hill sharing about the affordability crisis that is happening right now in the US with members of Congress, and that's something that we do on the regular. But we're an advocacy group, and we help try to make things better for families in the nation.
So you work with people that are going to be directly affected by this healthcare price hike. And my health insurance premiums are going up 21% next year.
Wow.
But can you tell us some of the stories of the people that you're working with and what's at stake if Congress doesn't act?
Absolutely. So just last week, actually, we had, like I said, 2 Moms Rising storytellers on the Hill. They were there to testify about rising healthcare costs and just general affordability issues. One of them was named Nicole Sheaf, and she's a mom of 4 from New Hampshire. She's an occupational therapist, and she shared that pretty much in today's economy, that trying to make it with just one income feels impossible for her, and that Medicaid and the Affordable Care Act have been lifelines for her family. And she said, quote, "While the Affordable Care Act plan that her family has generally cost about $75 to $125 a month, I received a letter in the mail stating it would quintuple to $550 a month starting in January." So she really just emphasized that the rising cost of housing, groceries, utilities, and other essentials has forced her family to stretch literally every dollar to make it through each month, and that the looming cuts to Medicaid and to the Affordable Care Act threatened to send her family into over a financial cliff. Um, and she also emphasized that she was there because they're counting on lawmakers to recognize that working families are facing enormous challenges, and they really want Congress to treat this like the emergency that it is. We also have heard from well over 10,000 folks across the country in written stories and video stories. If folks want to share their stories with us, go to momsrising.org. We'd love to hear from you about rising healthcare costs. But Sarah in Junction City, Oregon, wrote to us to say that the impacts of cuts and rising healthcare costs on her family are not merely financial, they're an existential threat. She said, "My 2 kids have Duchenne muscular dystrophy. The rising cost of standard care alone, simple things like copays for specialist appointments or deductibles on equipment, forces us to constantly choose between life-saving care and basic necessities. Rising costs are forcing us to delay necessary home modifications like ramp installation because every extra dollar must be saved for unpredictable emergency medical expenses." And this part especially hit me in my heart. She said, "For a family managing a fatal pediatric condition, cuts to healthcare are not an abstract policy debate. They are a direct, cruel reduction in our children's short time on Earth, and a crushing burden on a mother already facing extreme barriers." So we've received literally thousands of stories like this from our members all across the country, moms, caregivers, dads, grandparents, who are just incredibly burdened and feeling the strain of rising healthcare costs, and that they're just buckling under the weight of the enormous costs of healthcare.
And you mentioned if people have a story, they should go to momsrising.org and share it. But
Yes,
that only gets people so far because the people that can actually change the situation are our elected officials in Congress and President Trump. So,
yes.
what can or should people be doing to move those people that get to have a vote?
Absolutely. So I love this question. We don't just share stories. We love to direct people to easy actions. And Moms Rising focuses on actions that moms can take in the evening, after bedtime, or whenever it is convenient for them. So we like to provide multiple ways that people can take action and contact members of Congress. Tuesday, which is tomorrow at the time of this recording, it's December 9th at 2 p.m. Eastern Time. We are going to have a tweet storm or X storm to end the healthcare price hike. And we're asking folks to tag their members of Congress. You can do this on any and all of your social media platforms. And the general idea is that we want to call on Congress and build momentum around the urgency of this issue. If you want to sign up to get like real-time information about this action, you can visit momsrising.org/HC Storm for healthcare storm, HC Storm, and you can sign up to get information there. We also have a letter to Congress that's going to House members. We'll be sending it in very soon. So please, if you're going to sign on to our letter to Congress, go now. And that's on the front page because this is incredibly important. of momsrising.org. You can go there and sign our letter. And then, of course, we have a way for you to easily call your members of Congress. We're asking folks, especially if their members of Congress are Republican, to please give them a call, share your story, share the urgency for your family and your community around extending the ACA tax credits and also just lowering healthcare costs in general. But we can actually connect you directly if you text ACA to 888-418-5699, and then it'll ask you for your zip code if you're not already on our list. Hopefully you are already on our list. But then it will call you and you pick up the phone and it connects you with your member of Congress. And then also, I just want to say, be sure to share this episode. Like, talk to friends and help sound the alarm. This is really an all hands on deck moment. And so we need everyone over this week and next week to really be putting pressure on Congress, because the clock is ticking, time is running out, and millions of people's health and health care is on the line.
Thanks. And we've been talking about it on this show for many months now, but it's the rest of the world has caught up, and now it's front page story on various newspapers and on TV. I think especially as people get their premium notices, as they've gotten those notices in October and November, and as we're signing up for plans right now, people are seeing the sticker shock of how much this is going to cost us if Congress doesn't act. So I think what you said is so important, in that people should share this on social media. They should talk to their lawmakers, but also make sure your friends and neighbors are aware of what's going on and they contact their legislators and so on, because Congress will only feel the urgency to act if they hear from you. They have not acted. They could have fixed this problem at any point this year, including while they were giving tax breaks to billionaires this summer. They chose not to, but we need to make them make a different choice.
Absolutely. And also, I just want to emphasize, like, we know that families are stressed out right now. So I just want to offer kind of a final note of like gratitude and solidarity. We are not going to back down in this fight, but we do need your voice and your power and your advocacy to protect healthcare for all of us. So do what you can. We know that things are stressful right now and it's the holiday season, but try to weave, some of this talk into your holiday conversations with friends and family, and just, take literally under 60 seconds to be able to call your members of Congress or sign a petition or make it a goal to take action for healthcare this week and next week, so that you can check that off your list, and it'll be one more thing done on your holiday list for December.
Yes, so that we get a good present under the tree instead of a lump of coal.
Absolutely.
So I just want to say, for everyone listening and watching right now, you are not alone. As Felicia said, probably everyone you know is facing
Yeah.
huge health insurance premium hikes because, like she said, we have a healthcare system where if one area gets cut, it affects everyone. So regardless of who provides your health insurance, whether you have Medicare, Medicaid, Affordable Care Act, private insurance, TRICARE, any one of a number of different things, probably your insurance premiums are going up a lot next year. And you should talk about it with your friends and family. When you're getting together this holiday season, this is an opportunity for them to know they are not alone, for you to know you're not alone in facing these hikes, and for a chance to let people know who's responsible for this and who can fix this. Because this isn't just something happening to us. This is something that Congress chose to not do. They chose tax breaks for billionaires over making our health insurance more affordable. And it's important for everyone to know that this isn't just something that happens. This is a choice.
Yeah, absolutely. Absolutely. One thing that's important that I just want to emphasize for folks is that there are still plans available If you're uninsured or if you get your health insurance through healthcare.gov, we're definitely saying please still go and look at your options and look at your prices. If you got a notice that your prices are rising, like go and see what other options are available. We're not saying don't go to healthcare.gov. We're saying please still go to healthcare.gov and look at your options, because there's still financial help available for folks, but there is a subset of folks who are losing those premium tax credits, who are going to see their costs skyrocket. Healthcare costs are going up across the board, but we still want you to be insured, take good care of yourself, manage your health needs as you need, especially Moms Rising, we're moms. We want you to take care of yourself. So please make sure that you shop around for your healthcare options and go to healthcare.gov, see what your options are. But while you do that, also call Congress and let them know about your personal experience.
Thank you so much for joining us, Felicia. And that is a
Absolutely.
perfect segue for us to answer people's health insurance and getting covered questions. So, welcome to Louise Norris, the Health Insurance and Healthcare Reform Analyst at healthinsurance.org, and Diane Archer, the founder of Just Care and Senior Advisor on Medicare to Social Security Works. So, let's start with a question from Kathleen, who wants to know, is our Medicare affected by rising insurance prices? So, Diane.
Well, this is a perfect segue to what you guys were just talking about, because as you said, when one type of insurance goes up, it's very likely that it's going to affect every other type of insurance. I was thinking no man is an island, no type of health insurance is an island. They all work together. And so as a result of the one big beautiful bill and the $1 trillion cut to Medicaid, which has some impact even now and will have a greater one down the road, and the lack of the extension of the ACA subsidies, everybody is feeling the pinch, and people with Medicaid are feeling it in particular because of increased healthcare spending costs. So people with Medicare are seeing a big hike in their Part B premiums this year, and they are going from 202. They're going up 9.7%, $17.90 for the standard premium a month, to $202.90 a month. And the deductible is also going up by $26 to $283. So those are big increases for people with Medicare. And then people with Medicare who rely on Medicare savings programs to pick up some of these costs increasingly will not be able to, as a result, again, of the Republican budget bill. So that doesn't mean, though, that you shouldn't look to see if you're eligible for a Medicare savings program through your state Medicaid office. Maybe you'll be lucky and you will be eligible, and that will help you with your costs. I want to add here that the reason Medicare costs are not going up as high as other types of insurance is because Medicare actually does a better job of controlling spending than any corporate health insurance company. That's because the government, with Medicare and also with Medicaid, negotiates prices. It sets the prices that the government will pay for drugs, and that affects how much people will pay out of pocket for their health care. But it is what every other country does: France, Germany, England, you name it, Canada, Japan. They all negotiate the healthcare prices that are paid for services. We're the only country that only does it for people with government insurance. And we leave so many people to the free, quote unquote, marketplace, and the insurers just don't either have the ability or the desire to set prices. And that is what is largely driving up costs. And that also can be fixed by calling your members of Congress and saying, it's time that, like every other country, we have national health insurance. And the latest polls are showing that more and more people want that. And at the very least, we have negotiated rates by the government to bring down costs. The last thing I want to say is that Medicare Advantage, the corporate health insurance side of Medicare, is also driving up Medicare costs, and that should not be lost on anyone. We are overpaying them $80 billion a year. The Congressional Budget Office has projected $1 trillion over the next 10 years in overpayments to insurance companies. And you might be wondering, well, why is that happening? And the answer is that Congress, our Republican Congress, is not ready or willing to get back that money. And that extra payment comes out not only of the Medicare Trust Fund, but in the form of higher premiums for everyone with Medicare, people in Medicare Advantage and people in traditional Medicare. So another thing you might be calling your members of Congress about is to fix the payments in Medicare Advantage, which will bring down your Medicare costs and will help considerably with strengthening the Medicare program.
Thank you, Diane. And next, our question is from Losty Trekkie on YouTube, who wants to know, is it crazy that if you cross over your state's Medicaid threshold, instead of simply paying more in taxes for your insurance, your health insurance is just gone entirely? So, Louise, want to talk about that and how Medicaid works?
Sure, yeah. So for the most part, Medicaid is for low-income people. It's a government-run program. It's run jointly by the state and federal government, so it does vary from one state to another. But by and large, the first prerequisite for being in Medicaid is a low income. There are some exceptions, like families with kids with disabilities, depending on the state, can qualify for Medicaid to help with those kids' medical needs, even with a higher income. But most of the time, in most cases, to be in Medicaid, you need a low income. There are some states that have considered in their legislature the idea of opening up a sort of a buy-in program where people whose income is too high for Medicaid could still buy into the Medicaid program. So far, that hasn't gone anywhere in any state, but it is on lawmakers' radar. So if it's something that you would like to see, as we've talked about earlier in this program, contacting your lawmakers and let them know your thoughts. But the Affordable Care Act did structure things so that people don't just lose coverage altogether if their income increases above the Medicaid eligibility threshold. There are 3 states, New York, Minnesota, and Oregon, where they've implemented under the Affordable Care Act a basic health program, which picks up where Medicaid ends and then goes up to 200% of the poverty level income-wise. And in New York right now, it's actually 250 temporarily. But in those states, you transition from Medicaid to that basic health program, which is Medicaid-like in terms of out-of-pocket costs and premiums. It's basically free or very close to free and low cost for out-of-pocket costs. Once you pass the threshold for that, and in every other state, once you pass the threshold for Medicaid, you transition instead to the marketplace. And that's healthcare.gov in 30 states and a state-run marketplace platform in the rest of the states. That's where you have private health insurance, but the premiums are subsidized based on your income. And for folks whose income is just a little above the Medicaid eligibility threshold, the subsidies are really substantial. So you get a significant subsidy to offset the cost of your coverage. The problem, if we go back to what Felicia was talking about earlier in the show, if Congress doesn't extend these subsidy enhancements that are scheduled to expire at the end of 2025, the subsidies that people get in 2026 won't be as big, which means people will be paying more out of their own pocket for the coverage, for the same coverage that they had this year. And obviously, the lower your income is, the less wiggle room you have in your budget to pay additional premiums. I definitely second the idea of it. You definitely still need to go on healthcare.gov or your state's marketplace and comparison shop. Don't give up. Don't assume that there's nothing, because there might be an option that will still fit your needs. But that's, again, contacting your lawmakers and letting them know how your premiums are changing is definitely something folks should be doing this year. But so that is basically how it works, is if you don't qualify for Medicaid, and your income is a little above the Medicaid limit, you will qualify for subsidies in the marketplace where you can get private health insurance. You just need to be very mindful of shopping around and actively comparing all the different options that are available.
Thank you, Louise. And back to Diane. There is news on the drug pricing front. Let's talk about that.
Yes, there is news. So many of you may remember that during the Biden administration, the Inflation Reduction Act was passed, which requires drug price negotiation for people with Medicare. So that's another step in the right direction in terms of pricing and healthcare costs. And the way it works is that last year, the Biden administration was allowed to negotiate prices for 10 of the most costly, frequently used drugs where the Medicare spending was highest for people. And those negotiated prices will take effect in January, bringing down, we hope, people's copays to some extent and Medicare spending to some extent. And this year, the Trump administration has done what it needed to do, which was to negotiate prices for 15 additional drugs that Medicare spends a lot of money on. So the good news is that there are asthma drugs, cancer drugs, and the GLP-1 drugs that are for weight loss, that all have new prices from people with Medicare that are far lower than what they would have been. So you should see some savings if you're taking any of these drugs, and that is really great news. What would be even better news, and you could call your members of Congress about this as well, is if the government actually negotiated drug prices at the same level as other wealthy countries pay for drugs. That is something that Trump has said repeatedly that he wants for all Americans, not only Americans with Medicare. And when Trump wants something, he does his damnedest to get it. So we should hold him to that, because right now, the negotiated prices I was checking on at least a few of the drugs are still twice as high as the prices in Canada. And if Trump actually and the Republicans in Congress decide that we should not be paying more than other wealthy countries for our drugs, why should we be? Then maybe we can bring those prices down even further, and not only for people with Medicare, but for everyone in the country.
Thanks, Diane. And I think, as I mentioned also before, some states have prescription drug affordability boards that are using that negotiated federal Medicare pricing as a starting point to negotiate deals for their state for people that have private insurance or state-based insurance instead of Medicare. So it's important to get a good deal for the government for people on Medicare, for taxpayers in general, since all of our money goes into the Medicare trust fund, and we will all eventually get it back, hopefully. But it's also setting a path for states and for people with other types of insurance that will be able to benefit from that. So it's really important that we keep pushing to get a better deal on prescription drug pricing through Medicare negotiations and in the states.
Agreed.
So thank you, everybody, for joining us today. Affordable Care Act open enrollment is still going on. Go to healthcare.gov to get insured. Like people have said today, the numbers are probably not as good as last year for you, but you still need to go check it out, figure out what you can afford, what options are available for you, because it is too important to keep insured for whatever happens, because America is the only industrialized country that has medical debt and bankruptcy and people losing everything because of one accident, one unpredicted illness, or a chronic condition. So get covered. And thank you for asking your questions. Hopefully, we got you some answers. Please text or call in your health insurance and healthcare questions at 202-838-6837, and we'll answer them in future episodes. Join us next week for more on healthcare in America. Be sure to subscribe to my channel or podcast wherever you get your podcasts. My name is Laura Packard, and this is Care Talk.